Hello everyone. Today, we're diving into the world of a medication called Propranolol, commonly known by its brand name, Inderal. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Propranolol, often recognized by its brand name Inderal, is a beta blocker that is available in oral tablet form. Its primary function is to manage various cardiovascular conditions by blocking the action of certain natural chemicals in your body, like epinephrine, on the heart and blood vessels. This effect lowers heart rate, blood pressure, and strain on the heart. Initially approved by the FDA in 1967, it's primarily prescribed for hypertension, high blood pressure, angina, chest pain, and irregular heartbeats. Additionally, it plays a role in treating and preventing heart attacks, reducing the frequency and severity of migraine headaches, and managing anxiety and certain types of tremors. Inderal is also beneficial for people with certain types of heart rhythm disorders, such as atrial fibrillation, and can help prevent complications from these conditions. It has applications in treating hypertrophic subaortic stenosis, a condition where the heart muscle becomes abnormally thick. Warnings: Propranolol comes with its set of precautions. It's not intended for those with severe heart problems, such as uncontrolled heart failure or slow heartbeats, bradycardia. Additionally, it's not recommended for individuals with asthma or other breathing disorders due to its potential to cause bronchoconstriction. Those with a history of severe allergic reactions should use propranolol cautiously, as it might make allergic reactions harder to treat. Propranolol should not be stopped abruptly, as this can cause severe heart-related complications. Instead, any discontinuation or dosage adjustment should be done gradually under a doctor's supervision. Before taking this medicine. Before starting propranolol, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the heart and blood vessels, those with heart diseases or conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood pressure and heart rate is advised for those on this medication. You should not take propranolol if you have asthma, very slow heartbeats, or a serious heart condition such as sick sinus syndrome or AV block, unless you have a pacemaker. It's also important to inform your doctor if you have had heart disease, circulation problems, Raynaud's syndrome, pheochromocytoma, a tumor of the adrenal gland, thyroid disorders, liver or kidney disease, or chronic obstructive pulmonary disease, COPD. Additionally, let your healthcare provider know if you have diabetes, as propranolol can mask the symptoms of low blood sugar, hypoglycemia. If you are scheduled for surgery, inform your doctor as you might need to stop taking propranolol for a short time. Side effects: all medications can have side effects, and propranolol is no exception. Some individuals might experience dizziness, fatigue, or lightheadedness, especially when starting the medication or adjusting the dosage. There's also a potential for gastrointestinal issues such as nausea, vomiting, or diarrhea. Additionally, there is a risk of more severe side effects like shortness of breath, swelling of the ankles or feet, sudden weight gain, or unusual tiredness. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Other potential side effects include slow heart rate, depression, sleep disturbances, and cold extremities. In rare cases, propranolol can cause serious allergic reactions or exacerbate symptoms of certain medical conditions, such as psoriasis. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: propranolol might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that can interact with propranolol include other blood pressure medications, antidepressants, antipsychotics, certain asthma medications, and drugs used to treat heart rhythm disorders. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking propranolol. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of propranolol can vary depending on the condition being treated. For high blood pressure, the typical starting dose is 40 mg twice daily, which may be adjusted based on the patient's response. For angina, The usual dose ranges from 80 to 320 mg per day, divided into multiple doses. For preventing migraines, the dose is usually 80 to 240 mg per day, divided into multiple doses. It's important to take propranolol exactly as prescribed and not to alter your dosage without consulting your healthcare provider. Avoid. While on propranolol, it's advisable to stay hydrated and avoid alcohol, as it can exacerbate certain side effects like dizziness. Given the potential for dizziness or fatigue, it's wise to be cautious when driving or operating heavy machinery. Additionally, avoid sudden position changes to prevent lightheadedness or fainting. FAQ. Many wonder about the age restrictions for propranolol. Currently, its safety and effectiveness in individuals younger than 18 are not well established for all conditions, although it is used in certain pediatric cases under the guidance of a healthcare provider. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of propranolol. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.